Hello and welcome to this evening's webinar, an introduction to IVF at Therapie Fertility. My name is Renee von Medin and I'm a part of the Therapie Fertility family, and I'll be hosting this evening's event. We are a nurse-led clinic and I'm delighted to be joined tonight by our head of nursing, Melissa. Mark, thank you so much for being here.
Thank you for having me on.
For the next 40 minutes or so, we will be talking you through all of the services that we provide at Therapie Fertility and discussing IVF and fertility treatments in Ireland. Before we get started, I'd like to remind you that you can ask any questions throughout the webinar, which we will do our best to answer towards the end of the event. And of course, if you have any additional questions after we finish, you can get in touch with us via our social channels or through our website. So before we start getting into Therapie Fertility, I would just love you to introduce yourself to anyone watching.
Thank you. So my name is Melissa. I am the nurse manager in Therapie Fertility. And I have been working in fertility for about 7, nearly 8 years, I think, at this stage. Came into fertility through the sort of general nursing route as opposed to midwifery, which is sometimes a wee bit of an unusual route to take because a lot of midwives work in fertility. But I was very lucky how I got into fertility, and best thing that happened to me.
Okay, so let's talk about Therapie Fertility. We opened last...
So started seeing patients in July last year. Therapie, obviously quite a new clinic, and I suppose the important thing about us is that we're trying to just be a little bit different to what's on the market there already.
And in what way? Like, what makes Therapie Fertility different?
So I think the main thing that we're looking at is we're trying to be more accessible for patients.
Yeah.
And how we're doing that is certainly through our prices for treatment. And what we're doing is we're taking a little step back from things as everybody that's there, and just offering sort of really evidence-based treatments.
A kind of more streamlined approach.
Yeah, streamlined is what I would say.
So we're not offering maybe some of the traditional add-ons that people might be used to. We're kind of more so providing, the basics almost.
Yeah.
IVF, ICSI,
yeah,
IUI.
Exactly.
Yeah.
So I was actually trying to avoid saying basics, but that is, yeah, it is. It's not that it's just that we're trying to, streamlined is what you said. We're I think we've heard a lot of people say taking the noise out of it. So the add-ons, we're doing IVF, we're doing ICSI, we're doing the IUIs, but we're not offering the other things. Or not so much that, so I suppose trying to not put the pressure on people to
pay for those additional add-ons.
Yeah. And what we are doing is that some things that are sometimes charged as add-ons,
you're building those into
our packages.
So one of those big things would be the use of the Embryo Scope. That is just a standard with all. Yeah,
so all our IVF ICSI packages include the use of the Embryo Scope and also the blast culture, which if people are familiar, if they've done treatment elsewhere, they'll know that that's things that are usually on top of a cost of an IVF.
Yeah, and if you don't know what a blastocyst is, that's basically just growing out an embryo to day 5.
Yeah. So it's the name that we give to the embryo at that stage, and that's you said it, grow it to day 5. Yeah.
Okay, so we've kind of touched on the headline items,
treatments that we offer. Yeah.
But let's talk a little about each of those. So we're talking IVF and ICSI, IUI, options for same-sex female couples, use of donor sperm, egg freezing, a big one, and fertility testing.
Yeah, so the IVF ICSI, so just, I suppose, if people are not familiar with what that means, essentially, it's what we're doing is we're taking egg and sperm into the lab and we're creating embryos in that lab environment. ICSI is just a variation of IVF. It's where we pop a little wee intervention in there at the fertilization stage, where we inject a single sperm into an egg, and that's usually done when there's a known maybe issue identified with the sperm. IUI is maybe taking a step back from that. That's a little bit less invasive. So that's an insemination. So what you're trying to do with that is you're preparing the female with hormone medications, and then what we're doing is we're getting a sperm sample, preparing that in the lab, and then we are injecting that sample so through the cervix into the uterine cavity, and the idea being that you're trying to get the sperms
as close as possible.
Exactly, at the right time.
Yeah.
Then we touched on, you said, well...
options for same-sex female couples, yeah.
All of those options that I've discussed there, the IUI or the IVF, also then reciprocal IVF, which is something that we're offering to people.
Which I am a personal fan of, because
I know you are.
We have our 2 children through reciprocal IVF.
Yeah, so I'm like delighted that we're offering that there. So with reciprocal IVF, what we're doing is essentially someone would come, a couple would come in, and one of them decides to go through the egg collection procedure and create embryos, and then those embryos are available for either partner to then
so you're essentially sharing that IVF journey.
So what it means is that there are, previously people could do it, but it was almost like a donation sort of option. So it meant that if one donated, they couldn't then carry the embryos.
Whereas now either or both can use those embryos.
And it's done in a package that's much, that's what it's designed for. It's much more inclusive, I think, in that respect. And
then egg freezing?
Egg freezing. So egg freezing, we have that as an option for people. So we've spoken about this before. Egg freezing has been around for a while, but more so for people that were like oncology patients that maybe needed to freeze eggs for future use. But it's now available as an option for people if they just think that they're not in a situation to potentially get pregnant right now, and just to try and take a little bit of the pressure off of that ticking clock, I suppose.
So the egg freezing cycle really is like the first part of an IVF cycle.
Exactly, yeah. You're doing all of the same workup. So we're as somebody that's doing an IVF, but it's essentially that it stops at the sort of egg collection part.
Yeah, so it's like the egg collection with no intention of becoming pregnant immediately.
Yeah. So when we collect the eggs in an egg freeze cycle, the eggs are then stored. So the embryologists would freeze the eggs, and then if you were to use them in future use, it must be through like an IVF ICSI cycle. But that's
so I've had people ask before, can you put them back into the body?
No,
unfortunately you can't.
No. So it does mean that if you needed to use them in the future, because the idea being with egg freezing that you might not need to hopefully use them, but if you did, it would mean that you're doing a sort of an ICSI cycle with those. But the thing is that you've done the hard work of the IVF ICSI cycle with doing all the medications and the egg collection. You've done that already.
Okay. Then let's talk about testing.
Yeah, so testing we can do, so a lot of people are coming just for baseline investigations to sort of see where they're at, which is for women, usually looking at egg reserve, so AMH testing, and that's because as females, the biggest factor that's affecting fertility is age, and that being because as we age, our egg reserve starts to reduce. So we can test to see where that egg reserve is.
And at about what age does that usually happen?
So the great big one-size-fits-all number that we
35.
put out there, 35, yeah. But it's, again...
in your 30s, usually.
Yeah, we it's not like you just wake up on your 35th birthday and they're dropping off. It's not like that. But that's why it's important to make people aware
and be proactive about maybe getting tested.
Exactly, because just because it is 35 doesn't mean that it might happen sooner for somebody.
For some people it might happen sooner, and then someone who is 35, 36 actually might not be affected as much by someone else.
And I would say that interestingly, I've actually met quite a lot of men that are coming through just for
to get checked.
Semen analysis. Yeah,
that's great to hear, isn't it? Because I'm sure that's not something you would have seen in recent years.
Not that I saw previously. They would come in maybe as a couple, but I've met a few single men coming in that just want to do semen analysis. Yeah,
that's amazing.
Yeah.
So. And so for men, you do this semen analysis. Yeah. And is that all you do? Or?
So mostly that, like, again, a bit like, so if I said AMH for female, that's one part of the testing that we do. AMH is the sort of, the semen analysis is the sort of one most important test for the male. obviously, if things come up in these tests, we might recommend additional testing, but they're the sort of baseline that you're going in at.
Yeah. Okay, so let's go back to, let's say, take an IVF cycle. And I'd like to talk a bit about the patient journey.
Yeah.
Just so people kind of get an idea of what it's like to actually come for treatment, and, you know, how many times are you going to need to come to the clinic? Who are you going to meet along the way? How will you be communicated with? I think it's really important for people to get a really good idea of like how much time they're going to spend.
Definitely.
In treatment.
Those are kind of all of the things that I'm ticking off when I'm chatting to somebody in a consult, because I know that that's the things people are thinking about when they come in. A lot of the time, if people come in, they actually know quite a lot about it because they've done their own research, but they're the things they want to know. So firstly, if you're coming into therapy, you've already mentioned we're a nurse-led clinic. So when a patient makes the decision to come and see us, they're going to come and see a nurse first. So you see a nurse for initial consultation, which is a little bit different to some other places, because you might initially see a doctor, but you come in, you meet with a nurse. So
and that's free.
Yeah, it is.
Which I think, you know, I just think that's really, it's amazing that we're offering this. And I know you feel the same way, because it kind of takes a bit of the pressure off, because sometimes, you know, let's be honest, fertility treatment is an investment, and it's, you know, something that you really need to think about. And if that kind of pressure is taken off for that initial visit, it kind of allows you to come in and have a chat, see what it's about, and just chat about your options without that pressure.
And I think some people maybe just think, oh, I'll just book in to see, and then, you know, you can see things progressing in the consult to be like, actually, maybe I will move this a little bit quicker than I kind of initially thought. They might just have thought they would come in and have a chat with us. But so
when they come in initially, what are all the things you go through, and do you do any of that testing on the same day?
Yeah. So initially, before they come in, you would so if anybody's coming into us, we'd ask you to fill out like a little health questionnaire first. It's just some information, like your if you've got any medical conditions we need to know about, if you've had a bit of treatment or any testing done before, and obviously if you've got your results, that's fantastic. You can upload them to us so that we've got access to that. And you may not have to
repeat them.
Yeah, because results are transferable. So people have the opportunity to do that first. Now, don't panic if you've been somewhere else and you've had tests, and sometimes people can't get hold of the results quick enough, and that's fine. You can send them on to us when you get the chance. But you come in, you'd meet with the nurse, we'd have a chat about your sort of history to date, sort of what the options would be then based on that, and the investigations that we need to do. And because a lot of the investigations for a female coming through are blood tests, we can do that on the same day that the person is in. We might even be able to do scans if we have to do it. Otherwise, we can schedule appointments when you're in as well.
Okay, perfect. So someone has come in, they've had their initial nurse consultation, they maybe have had some scans, bloods done. What happens next?
So once the testing's been completed, you would come in and meet with one of the consultants. And the idea being that you're going in to meet your consultant with the results of all of the relevant information. You've had a good chat with the nurse. You already know what the sort of plan of action is. So you're coming in to talk with the doctor to just go through the results and say, finalise a sort of IVF treatment plan.
And the consultant will have had a look at your file, will kind of know.
So really you're getting the most from your consult at that point. And it means that you've kind of come in, you had that time with the nurse, you've had a wee bit of time to go off and think about it. When we meet you, so the nurse consult, we'd also send you on consents to the treatment. And the reason that we do that is there's lots of information in that, and it just gives people a bit of a chance to filter through that
space to take it in, as opposed to sitting in front of a doctor and like trying to read through all the small print.
Probably the first 10 minutes you're in, the anxiety, you're just waiting for that to settle, so you're not really taking in any of the first part of it. So at least if you go in the second time, you've been in the building, you know what it's like, you know, you're a bit more familiar, and you've got that chance. I say to people, just write down the things that you want to ask as you're coming through the consents, and you see that, and then when you go in, you meet the doctor,
and you can have your questions ready to go. So once you have had your consultation with the consultant, at that point, if you're ready to move forward, let's just, for argument's sake, say you're doing an IVF cycle. At that point, how quickly can you start, and what's the next process, like getting a prescription or?
Yeah, so we're really lucky in that we're in a situation we don't have the longest waiting list. So we have a second Embryo Scope there, which is because we're always trying to minimize the wait list for
Sure.
people, because people don't want to be waiting to.
No, and also for a lot of people, it is time sensitive.
Yeah, absolutely. So you meet both kinds of people, the person that wanted to start yesterday versus the person that's like, I'm going to think about it. But essentially, if you come in, you're probably looking at, so if I met somebody, or if one of the consultants met somebody this week, you could probably be started for treatment in the following month, really.
And it kind of depending on your cycle.
Yeah, absolutely. And so, we talk, you would get your treatment plan from the doctor. We organise your medications and prescriptions to go to your pharmacy. We have a chat about cycles, and you kind of have a plan then for what that will look like.
Okay, perfect. So once, let's say you're starting your cycle, you've collected your meds, and you're just blown away by the amount of medication.
Yes, that wouldn't be hard to do, because you get bags of it.
How does a person know how to kind of administer their own meds?
Yeah. So that's a really good question, and I know that we've spoken about this before with your own experiences, Renee, with the medications, like so overwhelming. So what we do is that we have injection demos on our portal.
Very good injection demos with a lovely tutor.
Don't know about that. Poor Renee had to endure those videos being made.
They're very good, and there's been a lot of wonderful feedback that they're very helpful. But it is, something that you can go back and watch over and over again in your own time.
Absolutely. Like I know from where I've been in a situation where I used to do demos to people. You showed them, you'd maybe 3 or 4 injections to show them. You showed them the first one, and they just had like a look of fear. You knew they didn't take in anything else and then also it was maybe 6 weeks before or a month before they were due to take them.
And then by the time they start actually taking them, they're like, oh.
So I know from before that we used to get way more queries about that, about injections and things, when people were showing them once by a nurse versus now when they've got them. Means you can watch it. We recommend people to sort of have a wee look before they're due to take them. But then when you're actually away to take your injection, you can just press play on that video. You can pause it, do the wee bit that you need to do, rewind it if you need, So it just works out much easier.
Okay. So you've started your medication, also known as stims or stimulation, which is basically stimulating your ovaries to
grow follicles. So in a natural cycle, that's what's happening. You grow one follicle, but we're given medications that are similar or the same essentially, but we're trying to just do that at a higher level to try and just stimulate more follicles to grow.
So it would kind of be like going through a normal cycle, but times that by X amount. I know people feel it differently.
Yeah, and I know like so many people are anxious about the medications, and I would say that like people's anxiety about it is worse than it probably is. Yeah. Everybody's individual, and different people will have different reactions or feelings, and each person's cycle might be different. You might have somebody that have done a few cycles and have different reactions or responses to it. But most common side effects, headaches, I suppose, if you're prone to them, tiredness, little bit of discomfort, sort of abdominally because your ovaries are getting a little bit bigger. Yeah. So, and mood wise, again, most people are fine. I say the anxiety is about that is probably worse than it actually is. But, you are asking your body to do a lot. And I think part of the other thing is that people are doing this alongside life.
And life in our kind of society is hectic and crazy for most people.
So you just need to cut yourself a little bit of slack there with that. Yeah.
So once someone is on their medication, how long is that period of time usually, and how many times will they have to come back to the clinic? Just thinking of people who maybe are traveling to the clinic.
And we do have people that are traveling from, you know, all over the country and traveling from out with the country as well. So I kind of usually explain a cycle falling over, I would say usually a 3-week period. I would break it into the first sort of 7-day block of that. So I think of it kicking off really with the period. The first 7 days are just taking injections at home. No need to be traveling to the clinic at that point. So you can fit that in around work and life as normal. That second week is the busy week, and that's when you need to be available to be attending the clinic for appointments. So you asked kind of average number of appointments. I would say sort of 3 to 4 appointments. So you're looking at 2 to 3 scans. Now, scan appointments are all early morning appointments. So our list runs from 7:45 sort of through to 9:30. And the reason for that is because sometimes when we're scanning people, we need to do bloods as well. And we need the results of those bloods back the same day. So we have to get people in early so we can get that results. But it's a 15-minute appointment. You're in, you're out. Most people can then, you know, if you're, I suppose, a little bit more local, head on to work, sort of manage it around things like that. So 2 to 3 of those appointments, and then also egg collection. And that's still falling in that sort of 7-day block. Egg collection is a sedated procedure in the clinic. So you need to have a day off work for that, absolutely. And ideally, I would always tell people to have the next day off as well. Great if it falls on a Friday and you're off at the weekend, but if not, try and have the next day off as well.
Okay, so just ahead of the egg collection day, what happens in the lead up to that? Is there like an additional medication that you take?
Yeah, so when we're doing the scans, what we're doing is we're monitoring, we talk about monitoring the response, and what we're essentially doing is we're measuring the size of follicles on the ovary, because we know that when they get to a certain size, there's potentially mature eggs there. So we're trying to get it to that sort of right point. And when we get that point, what we're going to do is we're going to give a medication which essentially would induce ovulation. But the idea is we bring the person in for egg collection before ovulation happens.
So it's quite time sensitive.
It is, yeah. So we can't estimate a date of egg collection when we sort of, maybe even from the first scan. So if I saw somebody on a Friday, I might say, I think your egg collection will be next Wednesday. But like,
you're not going to know until you have that final scan.
But you're kind of looking at having 2 days notice, because your trigger is sort of 36.5 hours. So you've got that little window.
Okay.
But you know that it's going to happen in that second week block. After egg collection, so you've done your 2 weeks of hard work, you've done all the injections, you've done your scans and your egg collection, and then the third week, that hard work is moved into the embryology lab, and they're going to look after and culture the embryos up to blastocyst stage. We spoke about that earlier, and at that point you would come back in for an embryo transfer. So
that's if someone is having a fresh embryo transfer. There is also the option, and then for some people it is kind of medically indicated to freeze those embryos.
Point. So that would be what we call a freeze-all, for if we're concerned that anybody's at risk for overstimulation. So that is obviously it's a medical risk. So what we do there is everything is the same, doesn't change what we've talked about, but you and they still do all the same work in the lab. But when the embryo gets to blastocyst stage, they'd freeze the embryo, and that gives you a wee chance your body to recover. So what would happen is egg collection, you don't take any other medications. You'd get a bleed then about kind of 7 to 10 days later. All the hormone levels settle back down, and then at that point you can just restart medications for a frozen embryo transfer cycle.
Okay, so that's kind of like the complete journey of an IVF cycle. Do you find that people are coming in more for the fresh cycles or the frozen cycles? And is there a difference in like the success rate?
No, so the majority of people come in with the intention of doing fresh cycles. Some people will come in with the plan to do a frozen, not because of a medical reason, but because, again, just
timings, maybe someone's getting married or buying a house or work, or
and that is a reason sometimes. But no, frozen embryo transfer success rates are comparable to fresh, and I certainly would be advocating for embryo. If you're not feeling well because we've given you a lot of medications and you're overstimulated, absolutely it would be the right thing to do, and I wouldn't be concerned about it impacting on success rates.
Okay. Let's talk about something that sometimes people don't like to talk about, and that's money. I know Irish people don't like to talk about money a lot, but it's important and it's a big part of the treatment. And so we talked a bit about how Therapie Fertility is more affordable than some other clinics. And so let's talk through those prices.
Yeah, so the cost of treatment, it's probably the biggest factor, I'd say, for a lot of people. And I think coming into this, we all knew that it was, but we didn't realise how much. So cost-wise, if you're looking at an IVF cycle, $3,995 for that, with options for financing, which is a massive thing.
And what
for
does
patients
financing
as well.
mean?
So it means that we work with a third party who provide financing options for people so that they can make monthly instalments to cover cost of treatment. And the great thing about that is that it doesn't mean that you have to so what sometimes people think they have to pay off all of those installments before they can begin have treatment. That's not how it works. Also, you've got a little bit of wiggle room on how much you're going to finance there as well. So sometimes if people have saved a bit of a chunk of money for upcoming
that you
treatment,
might only want to finance half of it.
Yeah, exactly. And you've got that option. So it is a financing option. So obviously that's something that there's things like a finance check or credit check, but that's carried out between the third party and the patient. So that's not something that we're involved in or anything like that. But once you know you're going ahead with the treatment and you want to maybe look at that option, we can put you in touch with them to sort of arrange that for you.
So what is included in that $3,995?
So everything that you would expect and hope to be included in an egg collection cycle. So organising and scheduling, so the scans are included, any of the hormone blood testing that I mentioned we might need to do, your egg collection with your sedation is included, because I've sometimes had people asking me, do I have to pay for my sedation? And then the two big things that we already mentioned, Renee, so the Embryo Scope and the blast culture. Then the transfer is included.
The fresh transfer.
Fresh transfer, yeah. And then if you were in a great situation that you had some surplus embryos to freeze, the freezing process is included in that cost as well.
Okay, so I think this is really important to kind of note, is that this is everything that's included within the IVF cycle. If you need any testing before the cycle, that is charged separately.
Yes, yeah. So if you come into your nurse consult and I met you and I said, okay, well, we need to do this testing, you pay for that as you do it. But I think we've been quite competitive with that costs. And certainly we've worked a lot of them into profiles, so that it makes it again a little bit cheaper for patients. But so those things are paid up front, at the time of the appointment, and then the cost of treatment. There are other things that are not included in that, which is the same anywhere, which would be the medications. Yep. But we're lucky in Ireland that they are covered under drugs payment scheme. So MD with a PPS can apply for drugs payment scheme, and the medications are covered. So everything that we prescribe for a cycle would be covered in that.
And what's the maximum someone will pay in a month?
So I think the drugs payment scheme is now down to even €100. It was 114, but I think it's now down to 100. I think it was due to it, and I think we were looking just this week, and I think it has already came down to 100, which is amazing.
That's amazing, because I know like the cost of the fertility drugs would run into thousands. Am I right in saying that?
Oh, definitely. Yeah.
If you were paying out of pocket.
I've met people that are having treatment. Maybe they're traveling so
they don't have the PPS,
and they're nearly paying the same amount again
for the medication as they are for the cycle. Yeah. We're very fortunate to have that facility.
And it was important to us that we made sure that all of the medications that we were prescribing would be covered. So we're not prescribing anything
additional that wouldn't be covered.
Yeah. Now there's always little sometimes there's difficulties with medications, COVID and Brexit and all kind of things have played into that basket.
Yeah.
But we're so far we've been very lucky in that everything has always stayed on the drugs payment scheme. So
perfect. And is there anything else that isn't covered in that kind of package price?
yes. So the only other thing, and so if somebody's coming through for a treatment cycle, we are going to have any tissues or cells in the lab as part of that treatment. We need to do what we call a viral screen or an EU screen, which is a test for HIV, hepatitis B, hepatitis C. That's a requirement for our licence.
Yep.
Same in any registered fertility clinic in Ireland. And those blood tests are not included in the cost of the IVF. They're €100 per person. And once they're done, so there is a expiry date on those bloods. They're valid for 90 days.
So if you've had them done elsewhere, within the 90 days, you could still use them.
So those particular tests, because we because it's part of our licence and we're very strict on the labs that they are. So any of the other tests that I've mentioned, you could go off and get them done through your GP, but these particular tests we need to have done with us. Okay.
Yeah.
But once they're done and you have treatment within that 90-day period, they then become valid for 2 years.
Okay.
So it means if you're coming back through, you're coming through for a frozen embryo transfer in the future, you don't have to repeat those bloods for that. And we because they have that wee expiry on it, we're really careful. We don't want people to, we only do those bloods when we know, yes, you're going ahead with treatment.
You're going to have samples coming through the lab.
Yeah.
If someone was maybe thinking of doing it in a year's time, you'd hold off.
Hold off, absolutely. Yeah, we'd kind of you're looking to really do it in the month before you're going to start treatment.
Okay.
Yeah.
Okay. Now I think we're going to go to some questions. So we have some questions that people have sent in ahead of time, and then I'm going to go to the chat box as well and see what questions people are sending in. So some that people have sent in ahead of time, we've kind of touched on, but we'll kind of go into a bit more detail. So are the self-injections painful, and how do you do it? So are they painful? This is something that comes up a lot.
Yeah, so I would be very rude to sit here and say, no, they're not at all, because I haven't taken one of them, so I don't know. But what I would say is that they're subcutaneous injections. So it means that they just go into the fatty tissue. So it's a very small needle.
It is tiny needle.
So it means, and because a lot of the time people will use things like they might put ice on beforehand. If you're particularly needle phobic and things, you can talk to us. You can get some like anesthetic creams that can be prescribed to help you with that. And like I said, we already discussed the demo videos, which I think is a big help for people.
Even just psychologically to see it being done.
Some of the medications are known to cause like a little almost local reaction at the site. And that's, it's the kind of thing that...
Would that be like itchiness or redness?
Like kind of a red, itchy area, lasts for a couple of hours and then goes away. And that's the kind of common complaint. And sometimes bruising, you mentioned that. If you did get a wee bruise, it's fine. It's not a problem. You just avoid that site then going forward.
And if anyone was ever worried at some point during the process, how would they get in touch with you?
Getting in touch with the nurses, absolutely, if you are worried, it's so important that you do, because don't be sitting at home panicking about it, because don't think that it's a silly question. Would be to access the portal. So we have a portal messaging service, and that's how people communicate with the nurses. So you'd pop a message into there, we'd either respond through the portal, and if it wasn't enough with that and you felt like you needed a call, we're going to pop a call into you then.
Okay, great. Someone has asked, do you have to come off contraception before doing an egg freezing cycle?
Yes. So it does. So if somebody was on the pill, then yes, you would need to stop. But we're looking at just say a month before, essentially. So if you were looking at, you'd come in to see me today, and you were maybe thinking about going in March, we kind of have February as like a pill-free month within the cycle in March.
We've kind of touched on this, the main form of communication between the clinic and a patient.
Yes, so the portal messaging. So we we don't really have like a direct line into the nurses as such. So to contact us, it's through the portal messages, or then through if you were to ring in, you would speak to our brilliant patient coordinators, and they would then get in touch with the nurses to contact the patient.
And how are people finding the portal?
The portal, I think the majority of people love it, because certainly I find you're not playing sort of phone tag with people. So we've already said people are busy, they're in work trying to get through a work day, and then you're sitting there, you've put a call in and you see them ringing back, but you're doing something else. And then you have to go back through that whole process again. And then the other great thing being that the portal messages, it's written there, so you're not having to take notes, and actually you can go back and look at it as well.
Yeah, because sometimes when you're on a call, you might be in the middle of doing something and you can't really remember what was said. And you're trying to scribble down a note.
I've had people being like, I'm in the office, I have to run outside. And then, so it's just, I think that from that respect, it's certainly helpful. Obviously, there are times that people need a call.
Sure.
And we're not saying we don't make calls, that's not what it's like, but we're just trying to, I think that it's the better option for people, really. I think
just more kind of time efficient.
Yeah, it's kind of more in keeping with the way the world is, isn't it?
Yeah, absolutely. Okay, someone again on egg freezing has asked, what are the chances of getting pregnant using eggs that you've frozen? And if it's not a guarantee of pregnancy, then is there a point in freezing eggs?
So what I would say with that is that every person's sort of success rate is a very personal success rate or statistic, because it depends on when you froze your eggs, because a lot of that impacts on the sort of quality, because I spoke about age. So I would say, although it's not a guarantee, the people that are going down the route of doing egg freezing, if you're not in a position to get pregnant at the time, then this is, I suppose, the best option. It's what we talk about, it's better than not doing, or better than doing nothing.
Yeah. So it's something as opposed to nothing, and hopefully you wouldn't have to use them.
That would be, that is the hope essentially for egg freezing, that you don't need to use them, but you've got a little something just in the background there to take the pressure off, hopefully.
And a little bit of a more peace of mind, I suppose.
Yeah. It might be that, if you're watching this and considering it, that you come in and you do the test, and actually that's enough to reassure you, and you might need to do it, but it might just be the thing that sparks you to come in and have that conversation.
Okay. Someone else has asked, my husband is subfertile, will I need IVF in order to conceive?
So I kind of touched on this just a little bit, that so it depends. Again, obviously this is a question that I don't have all of the information on it. It might be that certainly treatment or some type of intervention would maybe just help you get to the point you want to be quicker. And although if there's usually an identified male issue, that I spoke about ICSI being the treatment option for that, which is IVF, but with this little variation at or intervention at the fertilization point.
Okay. Someone has said, I have been told I don't have many eggs and I am 35. What does this mean? So
I'm assuming that this person has maybe done some type of investigation. Yeah. What I would say is that if it's maybe an AMH test, it would be interesting. I would really be recommending this person make an appointment to come in and have a chat with us, because I would like to see what that testing was. It's one piece of the puzzle. We'd probably have a wee look at that and see, and have a chat about options for what that might be. I don't know what that person's situation is, and is it something we'd have a chat about egg freezing, or potentially an intervention to try and get pregnant, or just doing a wee bit more investigation for them.
What is usually recommended for someone who has had recurrent miscarriages?
So that's a really good question. When it comes to recurrent miscarriage, I'm really sorry whoever is going through that. We would certainly recommend come in and talk to us, definitely. If you're in a situation that you've been going through that, then we need to just do probably some further investigations to see is there an explanation as to why that's happening. and then see is there some sort of intervention that we maybe need to do.
Okay. What donation services does Therapie Fertility provide?
So we have the option for people coming through to use donor sperm for treatment. So be that IUI, so maybe a single woman coming through doing inseminations or IVF, or same-sex couple then using donor sperm for treatment. We don't do donor egg. We don't have a donor egg program at Therapie.
Okay. So for the donor sperm program, what sperm bank do we work with? And is it only one sperm bank?
Yes.
How does that all work?
Yeah, so really good question. Yeah, we only work with European Sperm Bank. So how that works is if somebody was to go onto our website, they'll see that there's a little link that you can go through there. So we have that working relationship with them that when you go onto their website through that link, they know that you are a patient of Therapie, and it means that they will only show you donors that are suitable or compliant with sort of Irish legislation. So it just means that you're not going on and picking a donor and then
have your heart set on one and then it's not available in Ireland.
They can't use
that
one. Yeah.
And what is the, we don't have to go into it, but what is the criteria for Ireland? Like how many families within Ireland can use one donor?
There's a couple of things it makes that we talk about them being able to be used in Ireland. So it would be family limit, which is a maximum of 3. So that means that only 3 people can use that sperm donor to create a family. What I always say to people is to bear in mind that that's the limit within Ireland. Could potentially have consented to more and maybe used other places, but the family limit within Ireland is 3. And the second part being that with the new legislation in place, we now have a donor register in Ireland, which means that anybody that goes through treatment in a registered fertility clinic in Ireland using any donor gametes, we must submit information to be held on that donor register. And those donors are aware of that and they've signed consent forms, so they know that their information will be held on that donor register.
So that basically means that if you have used a donor, you don't know their information, but any children conceived as a result can access that information once they reach adulthood if they should choose to.
Yeah, absolutely. So it's not that they're going to be presented with the information, but should they want to at aged 18, they can get access to that information. Okay. Yeah. So, and that you're right to say that it's information for the couple or person that's coming through treatment. It's for the donor conceived child.
Yeah.
So if somebody was coming through, they wouldn't have access to it. It's only the donor conceived child.
So anyone who has used a sperm donor, be that a single person, a same-sex couple, or a heterosexual couple, if you've used donor sperm, that information will be on the registry.
Submitted. Yeah.
Okay.
Yeah.
Now I'm going to go to the chat and go through some questions that have come in here. Okay. So if the egg collection or the transfer has to be done on a Saturday or Sunday, do you work at the weekend?
So we don't do those procedures at the weekend. At the moment, we are open Monday to Friday. And the reason that we can do that is because of the medications that we're given. We're essentially manipulating your cycles a little bit with that. That's the same in any fertility treatment. And it just means the way that we do that allows us to make the collections sort of fall when we want them to.
So what days do the transfers happen and what days do the egg collections happen?
Yeah, so at the moment we would have egg collections happening Wednesday, Thursday, Friday, and then the egg collections are always your 5 days later then for the transfer. Someone has asked, very good question, are there interest charges associated with the financing arrangement? Yes, there are, because it is a financing option. And I didn't mention that, but you've got, with the financing, you can choose to take that over a 12, 24 or 36 month period. And I believe I'm right saying that the interest charges don't change over those 3, which is quite handy.
Yeah, and I suppose it is a financing arrangement and that is...
Yeah. I think it's still it's a suitable and doable option for people.
Yeah. Okay. Are injections needed for all IVF treatments?
Yes, they are. I'm afraid there's no getting away from them.
There's no pill you can take.
I wish there was just that one magic pill that I could give you, but no. And also for our IUI treatments as well, the same thing, injectables. Even when people are coming through for the frozen embryo transfers, we do tend to use injectable progesterones, but we've got a wee bit of an option there where we can, so if somebody's particularly needle phobic or they'd, you can have a chat about that. But for the actual IVF part of it, or the stimulation part, unfortunately, no, there's no getting away from it.
What if your cycle is slightly irregular? Does this have an impact on the schedule of egg freezing?
No, because we can, as I've said, manipulate cycles a little bit with medications. So if somebody, we see loads of people with that problem with their cycles, maybe irregular, or maybe they only have 1 or 2 a year. So we can give medications to induce a bleed and just sort of regulate that time a little bit better. So no, not anything to worry about.
Okay. If the first embryo transfer fails, is that the end of the cycle? Do you then start a new cycle cost, even if more than one viable embryo is created?
So if you do a cycle and you've created, so you get to the point of transfer and you've got 1, 2 or 3 embryos, say, and you transfer one back and you're in a situation that you had those 2 surplus embryos and we froze them, at that point you would be looking to come through for what we call a frozen embryo transfer cycle, which is a much easier cycle to do, and it's a cheaper cycle as well.
The cost is
$12.50. Yes.
Yeah.
So much, cheaper compared to an IVF cycle. Now, if you were in a situation that you maybe only had 1 embryo to transfer and you did that and it didn't work, then unfortunately you would need to go through another cycle of IVF
in order to create more embryos.
To create more embryos, and the cost is the same again at that point.
Okay.
Yeah.
For someone who has PCOS and has very irregular periods, would you need more than 1 round of medication? I'm unsure if this is for egg freezing or for IVF.
Either way, no.
Yep.
Yeah. So we spoke about the irregular cycles. So we give medication that can, it's not that it regulates it, but we can induce the bleed for when we want it sort of to fall. And then it would just be the same. The risk with somebody with PCOS is that so when you've got PCOS, you have higher egg reserve. And so it's just, we need to be that little bit more cautious with the medications that we give in your response to the medications.
Is the danger that there would be overstimulation?
Yes.
Okay.
So we spoke about freeze-alls for medical reasons, and that would be just a little red flag for me that we know that going into it, and we're more cautious then.
So you perhaps wouldn't be prescribing as much medication.
We give a lesser dose, and we just monitor that
to see what the response is.
Yeah.
Okay. Yeah, because the medication can be adjusted throughout the cycle.
Yeah, if we needed to.
Okay. Someone again has asked, I have PCOS with irregular periods. Will this have an impact on the schedule?
So no, we give the medications to induce a bleed. Sometimes dependent on that, you might need to just come in for like a scan or a blood test to just see where your hormone levels are at before we give that medication. But that's sort of the height of the extra intervention that we'd need to do.
Okay. Is it possible to have an IVF treatment for someone who hasn't had a period for over 7 years caused by medication?
So obviously I'd need to meet that person and do a consult to see if cycles have been stopped because of medication. There's different reasons what that might be, and once we've got input from, so depending on what that medication is and the reason, we might need input from whoever's prescribing that as well, but certainly something that we could have a chat about. It's not something that I'm thinking would prevent us from doing a cycle.
Someone else has asked, does the procedure include any kind of counselling? Great question, actually, because we didn't touch on this. So for a single woman, and how to explain having IVF to a child. So this would be someone coming through for an IVF or IUI with donor sperm.
With donor sperm, yeah. So, and that's a really good question, because I should have brought that up, but anybody that's coming through treatment using donor sperm, it is a requirement that that person would attend for what we call implications counselling.
And is that a requirement by law?
No, it's a requirement by us, because we feel that it's important. Yeah. I feel that you need to make sure that person's counselled and has that information. You'd hate to think that somebody went through treatment and then had all these kind of questions and anxieties and things. So it's just that session. We have a link up with a fertility counsellor who specialises.
And she's wonderful.
She is amazing, yeah. She's one of those lovely people that when you're in the room, you just feel calm when she's there. So we would advise people now. Obviously, people can attend other fertility counsellors, but we do have a link with Claire, and that's not us saying you need to be off to be assessed to see if you can go through with treatment. It's a conversation about the legislation in Ireland and how you feel if you were going through as a single person. You might then tell friends or family, or how you might tell the child in the future. It's just putting loads of scenarios there to just prompt you to have a chat and think about them. We would get a report back. It doesn't disclose what you've discussed. It's essentially saying attended for this session. We had
this session, yeah. And I believe that's not included in any of the packages except for the reciprocal IVF.
Yes, it is. So if you were going through for an IVF using donor sperm, then you would pay for that session. It's a once-off session. But if you're coming through for reciprocal, it is included.
Yeah, and I suppose that's because none of the other packages require donor sperm except for reciprocal has to have
it.
Donor sperm.
Yeah.
Okay, so can you explain CMV to me, please? If a donor is positive, can we still choose him?
Yes, so that's a really good question, and something that I usually do have a chat with people. So CMV essentially is an infection that we could have all been exposed to and not know really. The reason that it's something that's talked about in this situation is because there's a suggestion that if a person in pregnancy got CMV, that it could be affect the child, the pregnancy. So somewhere along the lines, a big leap was made that if you were CMV negative and you used a CMV positive donor, was there a risk to the pregnancy? You don't check your partner's CMV status if you're not using donor sperm. We don't check CMV status in therapy. I believe that some clinics are probably, and I know that it's something we'd been kind of moving away from, some clinics still do tests, and that's why I bring it up, because if somebody's been elsewhere or if they're chatting to people, so what would happen if you were CMV negative? It essentially meant that you had to choose a CMV negative donor as well. And what that meant was it reduced your options. So it's something that people talk about. So I'd always bring it up to make people aware that it's not that I'm ignoring or forgetting to tell you. It's not a requirement.
Okay.
So if you were CMV negative, you can use a CMV positive donor.
Okay. What are the success rates first go for someone who has already tried the fertility medication Clomid?
Okay, again, that's a really difficult question for me to answer. Success rates are so individualized to a person. We need to look at a person's history. I spoke about age, male factor. There's lots of things to take into account there. So really what I'd be recommending for that person is to come in and have a chat, and we can get more of a history, and then at that point with results of tests and things, give a more personalized statistic.
Okay, I'm just keeping an eye on the time. We have just a couple of minutes left. And do you know what? If we can't answer all of these questions, we will answer them after this webinar ends. And we put out lots of videos on our social channels, so we will definitely get to all the questions afterwards. Can you transfer one embryo or multiples?
Good question. So we will always really push for single embryo transfer because it's the safest thing to do. I know people might think, if I just came through and I didn't transfer two and got twins, that would be fantastic.
I was that person.
Yeah. But we don't want to make people pregnant with twins, because a multiple pregnancy, it's a high risk pregnancy for the person coming through, for the babies as well. And I mean, we're talking about risks like, premature delivery and then other things with that, gestational diabetes, those things that you don't want to be a risk or increase that risk factor. So every person is individual though. and you need to think about, because there are certain things that might mean you'll definitely never transfer back more than one. So if somebody's had some treatment to their cervix or something, sometimes you would never be putting back more than one. But we look at a person's history, quality of the embryos. It's certainly a two-way thing between a doctor and the patient.
So it's not just a blanket no, but it's in most cases it's one.
Like we're going to go with what's the safest thing for the patient. Somebody's younger and kind of unexplained, maybe your infertility, we're going to go with that one because that's the safest thing to do.
Yeah.
But it is, as I say, it's a dialogue that's happening.
Okay. Someone has asked, is it definitely not possible to use Cryos as a sperm bank?
Unfortunately, no, we can't use Cryos. We only are linked up with ESB.
Okay. I'm trying to scan these to see if there are some that are similar. Someone else has asked about the embryos. Someone else has asked about CMV. At what stage should you purchase sperm, and how many straws do you recommend?
Oh, so that does depend a little bit on the type of cycle that you're doing. If somebody's coming through to do an insemination, so an IUI, we usually are talking about potentially doing 3 goes, so 3 attempts, in which case we'd say order 3 straws. If it was an IVF, we're looking at 1 straw. So if I meet somebody for consult, what I'd usually say is go on and have a wee look at ESB. Don't be doing any ordering of the donor sperm until you've kind of come back in and had your consult to confirm the treatment option with the doctor, and then at that point,
because you don't want to be ordering 3 straws if you end up doing an IVF.
Because the investigations and things might change the recommended treatment plan. I would say the only kind of things for people to maybe reassure them time-wise is that we have shipments coming in every 2 weeks. So if you make your selection, you're not waiting a big long time for, we're not...
there won't be a huge delay.
Yeah. So it's quite seamless in that respect.
Okay, 2 questions left before we're going to run out of time. Do you recommend taking vitamins and folic acid before consultations?
Yeah, so anybody that's trying to conceive should be on folic acid, and we also recommend vitamin D, and that's all that we do recommend. You can absolutely, there's loads of multivitamins that are available, which are specific for people in pregnancy. What I'd say is just, it's one of those things you can really go down a rabbit hole with it, and they're so expensive as well. So more than happy that somebody's just taken the folic acid and the vitamin D, but if you are taking some of those other supplements, it's fine. I would stay clear of things like Chinese herbs and things like that. They have other issues sometimes that are associated with them, so the folic acid and vitamin D at most.
Okay, great. One last question very quickly. What is the cost of IUI?
The IUI cost is €800 for a cycle. You've got the cost of your medications on top of that, so 100 or 114 depending on what the cost of the DPS is. And then if there was male partner producing a sample, he only would need to be tested for the HIV, Hep B, Hep C, so it's €100 for that test.
Okay. Amazing. Thank you so much. If we have not answered your question, we will get to it. We'll make some videos and put them out. But I just want to say a huge thank you to everyone who has tuned in tonight, and a huge thank you to Melissa for being my lovely guest. Remember to follow us on our social channels, subscribe to our podcast, Fertility Talks, and also sign up to our newsletter so we can be sure to stay in touch with news of these webinars and any events that we might hold throughout the year. Thank you again, and enjoy the rest of your evening. Good night.